Andy Johnson. We're looking at what a meaning-based reading intervention could look like. This could be used for RTI or any other intervention. It is a comprehensive reading intervention, the goal of which is to enable students to create meaning with print. Reading is not sounding out words, it creates meaning. Now, in order for this to be useful, it has to be teacher-friendly, research-based, and this particular one can be used with RTI 1, 2, and or 3. Adopt and adapt. Important! Struggling readers have deficits in one, 2, or 3 of these areas. Word identification, recognizing words automatically during reading, and or strategies to figure out unknown words during reading. That could be one of the deficit areas. Comprehension, creating meaning with print. And then fluency, the ability to process text effortlessly and automatically. Readers have deficits in 1, 2, or all of these areas. It is important to know exactly what students' strengths and deficit areas are. Thus, any intervention must begin with a diagnostic assessment so we can identify those strengths and deficit areas. Most standardized tests are not able to do this. Most standardized tests compare the student to a normative population, so you know how far that student is away from average. I prefer an informal reading inventory of some sort. Qualitative reading inventory, any one of these. They use a miscue analysis and some other sorts of things. Because the intervention must be designed specifically based on that diagnostic or specifically according to what you find on the diagnostic. The intervention needs to build on the student's strengths as well as address deficit areas. One size of instruction does not fit all. One type of intervention or instruction is not appropriate for all students. If your deficit area is comprehension, well then focusing on fluency or word identification is not appropriate.